Is knee pain making walking upstairs feel like you're hiking up a mountain? Has just regular walking from day to day become a chore instead of a joy? If you're suffering with knee pain and you've been told that you have a meniscus tear, let's talk about your real options before jumping into surgery. First off, and most importantly, if you have been told that you're suffering with meniscus tear, or if you think you have, based on the symptoms you have, don't panic. Meniscus tears are actually way more common than you might think. Meniscus tears happen more frequently than you believe, and not just to athletes. And you may be able to heal without surgery if you understand the injury and the mechanics behind it. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I believe that movement is life and you deserve both. First off, what is the meniscus? So it is a C-shaped cartilage ring that's on the inside of the knee joint. So this is the tibia, the shin bone. There's a meniscus here. That's the lateral meniscus because it's on the outside of the leg. And there's a meniscus here. That's the medial meniscus because it's on the inside of the leg. And of course, there's some on the opposite side. It helps to provide shock absorption between the tibia, the shin bone, and the femur or the thigh bone. What causes a meniscus injury? Most commonly, it's a pivot shift type motion. So this is most common in most commonly when you're doing an activity such as skiing, playing soccer or football, or if you've been involved in a car accident. However, for some people it can happen with deep squatting or even lifting really, really heavy weights. Now, if you're over 40, you could get a meniscus tear from degeneration that's occurred in the joint just from regular wear and tear in today's society. And there can be poor biomechanics in the muscles surrounding the knee so that you don't have the knee stability you need that leads to a meniscus tear. So I have seen people doing kind of just regular activities, walking upstairs, walking downstairs, things like that, where they get a meniscus tear because the muscles around the knee were not supporting the knee joint properly and caused an injury that led to a meniscus tear. And who most commonly is affected by meniscus tears? Well, of course, we're pretty familiar with it in the professional sports world with basketball players and soccer players and football players, but really any athlete can suffer from a meniscus tear. But also over 40, it could be that you had an acute injury when you were younger in your knee that never properly healed to 100%, and it has led to some degenerative changes over time, maybe some poor biomechanics of the muscles around the knee, and then that can lead to a meniscus tear later in life. Or if you're someone who does a lot of kneeling or squatting, lifting or twisting with your regular day-to-day activities, this can lead to some wear and tear over time that could cause a meniscus tear. So how do you know if that is what you're suffering with? Well, the first primary thing is on the inside of the knee joint. So where the femur, the thigh bone, connects to the tibia, the shin bone, right along the inside of that joint will be really, really tender. Now, it could be on the outside of the joint too. It's just that the one on the inside is the most common. Often you'll have swelling in that same region and you'll have stiffness in the knee that most commonly will increase with activity. It may not increase during activity, but after the activity, that swelling and stiffness will increase. You may potentially have some catching or locking or clicking in the knee. Now, this is different than an arthritis grindy type sensation. This is more of an audible sensation, and this is something you feel. It's not that kind of grindy that happens in the knee when you have an osteoarthritis or something like that. It is more of a click or a pop or a oof. It's a moment. You know something's going on in your knee. And some people with a meniscus injury can actually have a flap. So that's when the meniscus actually comes off of the shin bone and actually flaps up, which that can cause you to not be able to fully bend or fully straighten your knee. Now, this one's a little bit difficult sometimes to figure out because if your knee's swollen, you also cannot fully bend or fully straighten your knee. But this is a different sensation. So when it's swollen, when a joint is swollen and you can't fully straighten or fully bend, you feel that sensation of like, I'm just, I'm blocked because there's this inflammatory, there's a pressure type of sensation. When it's a meniscus flap, it feels like I'm blocked, because I'm running into a wall. It doesn't feel like something that you could like slowly move through. It's like, no, it really doesn't move any further than that. And I will say for people who are suffering with a meniscus injury, who have a flap that is impeding normal motion, so that means you cannot fully straighten your leg and it is like running into a wall and it's not getting better, most likely to correct that, you are going to need to have surgery because that meniscus is flapped up and it is not allowing you to have normal joint motion. And there is not a lot we can do if the meniscus is staying flapped up. However, not all tears flap up. There's a lot of tears that happen, the meniscus stays planted on that shin bone and the decrease in the motion is actually caused more by the swelling as opposed to a flap. So that flap becomes really, really important when you're talking about what your next best step looks like. And with a meniscus tear, you are most likely going to have pain with squatting, with walking, with pivoting, with shifting. It just kind of gets aggravated when you're doing those different motions on that knee. So what can you do to heal a meniscus tear at home? So the first thing going to want to do is to avoid aggravating activities. Now, we don't want to immobilize the joint. We want to keep it moving as much as we can pain-free, but any activity that increases your pain is most likely going to increase your swelling, which is going to send you into that negative spiral. So as much as you can, pain-free movement, do pain-free movement. You also want to focus on strengthening the muscles that help to support the knee joint. So here we're talking about the quads, the hamstrings, and the calves, but we want to make sure that those muscles are strengthened appropriately. So a lot of people will get a meniscus tear and they feel like, oh, it's a quad problem, and so they'll strengthen their quads, but really their quads are already really strong. They're actually quad dominant, and their hamstrings are not as strong as they need to be. So then they strengthen their quads, which actually makes the problem worse because they become even more quad dominant. So it's important to make sure that you have a good balance between quads to hamstrings. The recommended is a 3-to-2 ratio. So for every 3 pounds, you can do a knee extension or a knee straightening exercise. You want to be able to do 2 pounds of a knee flexion or knee bending exercise. It is critically important that you avoid aggravating activities such as that deep squatting or pivoting activities early in your healing. Now, a lot of people will ask me, do I need to have some compression on that knee, or should I wear a sleeve on that knee? Now, here's my thought on that. Compression is not really going to change what is actually happening in that meniscus and in that joint. However, that being said, that joint is inherently unstable right now because of all the inflammation and all the things that are happening as that knee is trying to heal. So what that compression can do is it can increase the proprioception, or your brain's awareness of how that knee is moving. And that's important because it makes your body be more careful with that movement, so you're not putting those abnormal forces through the knee. So I do like to have some compression on any joint that is suffering with inflammation and not inherently stable, because it just helps remind the brain a little bit more, be careful with that particular area right now. But is it going to heal your meniscus tear? No. Now, once that inflammation starts decreasing and you're starting to get a little bit more balance in that joint, you want to make sure that you are working on balance activity, particularly single leg balance, if that's something you do regularly during your day or with your activity. Soccer players, I'm looking at you. And you may have to actually retrain your movement patterns as you're trying to get back to your activities. That can be everything from walking up and down the stairs to how you're running or kicking the soccer ball. Don't assume that everything's going to come back on board correctly. Make sure you have some assistance in ensuring that you're doing those movements correctly. And of course, we can never underestimate the importance of making sure that you have correct postural alignment, that you have good support on your feet for your feet and for the activity that you want to do. Now, you may be saying, Dr. Amy, that all sounds super great. However, I am an athlete, I am a mom, I have things that I need to do, and I cannot take the time to rest and heal the way I know I really should, but I got things to do. Well, my friends, if you are suffering with a meniscus injury and you simply do not have time to heal it, I want to tell you about something called regenerative therapy. What this combination of tools can do is actually help stimulate repair of the meniscus, decrease inflammation in the knee joint, restore normal motion through the muscles that surround the knee joint, including the quads and the hamstrings and the calf, and get you back to walking normally and performing your normal activities of daily living without any downtime. It will also help to decrease your pain so that you're able to walk normally, so you're not increasing trauma to that joint while you're doing your daily activities. It's really ideal for people who have degenerative changes in their knee joint along with their meniscus tear, or who are looking for ways to heal from a meniscus tear quicker because they got things to do in life. So when can you start regenerative medicine? Well, you can start it as quickly as the day of a meniscus injury, which is the beauty of it. Because with things like traditional physical therapy or any kind of exercise, we kind of have to wait during the first 2 to 3 days while the body goes through that normal inflammatory process. But with regenerative therapy, we can actually start that immediately to help speed up the body's natural healing. That being said, if you've been suffering for more than 2 weeks and you're finding that it is not getting better at all, and maybe it's even getting worse, you may be even decreasing the number of activities that you can do because your pain and swelling continues to get worse, I highly recommend you seeking out help from a professional who can figure out what is going on, because you're getting some compensatory techniques that are trying to protect that knee, and that never goes well in the long term. And friends, if you've been told that you have to have surgery for your meniscus tear, but you are looking for a second opinion, I highly recommend seeing a manual physical therapist or someone who does regenerative therapy to see if there's another option that's holistic that will keep you from having to go through that surgery and deal with that downtime. So I want to tell you about one of our patients, Jane. So Jane had come in to see us after she had gone to the doctor because she had knee pain, and the doctor had told her that she had a meniscus tear and that she had to have surgery in order to correct it. Now, Jane is in her 50s and she was totally ready to sign up for that surgery, but she had a very wise friend who was one of our patients who said, hey, listen, I need you to go talk to Dr. Amy before you commit to the surgery. And Jane is a good friend, so she decided to come in and see us before committing to the surgery. And her question to me was, can you actually heal the meniscus? Now, the great thing is that Jane actually had an MRI report. And in that MRI, it showed that the meniscus tear was in what we call the red zone. And when it's in the red zone, that means there's actually some blood supply in there, and that tear can actually heal. Also, one of the things we talked about during that initial discovery visit was that Jane was in her 50s and she had no desire to do activities such as basketball, soccer, or skiing. Her preferred activities were going for a walk, maybe going for a hike, walking her dog around the block. That's more the things that she wanted to be doing, along with riding her bike. So her goal was not to get back to pivoting type activities, or else our plan of care might have been a little bit different. So Jane actually came into our clinic before we had our regenerative therapy suite. And so she had our manual physical therapy. So that was focused on getting her joint moving correctly, restoring normal muscle balance, restoring motion through other joints that were not moving correctly, so that she could get back to walking and hiking pain-free, which I am very excited to say she was able to do. In fact, fact, not only was she able to get back to walking, but she was able to get back to walking on the beach when that involved walking down a really steep and rocky hill and walking back up it. If you live in the Maple Valley area and you've been told that you have a knee meniscus tear and you're interested in hearing more about manual physical therapy or regenerative therapy, I'm going to encourage you to click the link below to sign up for one of our free discovery visits. Now, if this regenerative therapy sounds super interesting to you, but you don't live in the Maple Valley, Washington area, I'm going to recommend you call the number that's listed in the description box below. She will be able to get you connected with a regenerative medicine specialist near you. And if you think that your knee pain might actually be coming from something other than your meniscus, I'm going to have you check out this video right over here.